So Micah and I didn't, we don't have a formal, I participated in 4 of these this week, I guess. And, so I've seen everything from like really formal structure to just free for all. And I think free for all probably is fine. There aren't that many of us, so.
And we have 25 minutes, is that right?
I think so, yeah.
Okay, great. Yeah, I guess I was thinking, based on the opening comments this morning, it would probably be good to think about things that we're doing well, and then what we need to move from prominence to preeminence in this particular topic, because I think we've gotten a good start, but we probably need to think about next level planning. So I don't know if that would be a good place to start the conversation. Folks can jump in a free-for-all style, I guess.
Yeah. I mean, I can say that one of the things that I think, and I think I've said this many times, but and I can compare to other places I've seen or been, that we have an incredible clinical throughput. Like it's very easy for somebody to drop in as an assistant professor, let's say, in psychology, and meet with Micah and her team and discuss how to get research participants and get well-characterized research participants. And I don't think that strength can be underestimated. That's amazing. And with minimal politics, minimal toll booths in the desert, you don't have to bribe the director. It's easy. And so that whatever we can do to make sure that stays healthy and sustainable is, I think, incredibly important and valuable.
I just wanted to add to that from the perspective of keeping that going. A big tool that's helpful with that is the research registry that we have been running for 2.5 years now. We have about 400 kids with autism in that. And so I think more support in keeping that going and connecting us with the NICU kids to continue to follow them is important. And a big barrier that we face in making that successful is the disconnect between the School of Medicine and the academic side, and just the challenges in integrating data, getting connected with those kids, the different just health system and academic systems. That's been a big barrier. And so I've been trying to think about how we can continue to work through those challenges, to figure out how we can speed up how we're recruiting these kids. And if we can come up with a system for recruiting these kids from the NICU, getting them in our registry, and then continuing to characterize them year after year using our clinical assessment team, and then adding in neuroimaging data, and using all the tools that we have across schools and departments, that could be such a cool, huge data set that I don't think exists in universities. So I don't know how, but I think that would be a cool direction for us to go in.
Like getting data at all levels of analysis on every research participant that's already in the registry, but then the NICU being people always kind of gives them pause when someone asks me about environmental causes of autism. I always say, well, number one environmental cause is the NICU. And everybody's like, what? And well, we keep babies alive that we couldn't have a generation ago. And that's why one of the reasons why there's an increased prevalence. And so, but that's a happy thing. It's now we need to learn how to optimize early neurodevelopment. And so if we could get that multi-level data on all of those babies, and the same I think would be true, Mark just joined us, of all of the epilepsy, kids that are coming through, whether they have autism or not. And then also potentially all kids that aren't in the NICU, so this we kind of jump to identifying a barrier to progress, which is that we've got this amazing clinical core for characterizing autism and for providing interventions and ongoing follow-up in the School of Education. But just simple little things like IT sorts of things, firewalls, clinical silos are preventing what would be more ideal, which would be somehow if any child came in to any clinic in the health system and had anywhere in their chart anything about autism, anything about epilepsy, other neurodevelopmental disorders, that somehow they were funneled into or provided the opportunity to be in this autism and neurodevelopmental conditions. I've just broadened the mission, Micah. But so that we're constantly, and the idea being that then anyone who wants to study these sorts of issues from any perspective, there's both a common registry, and then I'm pushing for a common set of data, including biological specimens. If they get an EEG to look for epileptic activity, that they get consented to provide this into a common data repository. And so now when people want to go after questions in autism, it's just super easy for them to jump in. Even if they're a resident, they could get into it without having to build their own autism clinic first. Or
I came late, so I apologize. But one of the things that it's amazing that you anticipated what I was going to bring up, which is a registry. And some institutions have gotten around some of the more limiting aspects of a prospective registry by having people sign HIPAA waivers.
mm-hmm.
And that is something that goes beyond this particular niche of questions, but I think is something that institutionally, I think this little group should perhaps report upwards. Because, for example, certain places like Emory, fell out of my head. they have a prospective HIPAA waiver registry.
Yeah.
That enables people to gather into very easily into registries that then can be mined.
Right.
And those HIPAA waivers enable retrospective data assessments that are vital for young career people,
mm-hmm.
And are vital for preliminary data that prospective funded studies can flow from.
Right.
And you and I know a couple young clinicians whose work could be hugely helped by having a more rich prospective and retrospective database. So I think this registry, not just for autism, but for what, let's say broadly, pediatric neurodevelopment.
Yeah.
Is
Mark, have you used some of the new tools that iThrive has created? I don't want to hijack the discussion, but
please.
You can go into Trinetics in 10 seconds, know every patient with autism and epilepsy. 10 seconds.
But now what we're talking about in addition is getting them in for...
That has to be HIPAA compliant. No way will you get a waiver that is so broad that allows you to contact patients without their permission. I cannot believe an IRB giving you that.
Okay.
I mean, you can ask for it, but if I sat on IRB, I'm not going to give you that permission. If you're going to contact a
Some
family,
institutions have been able to do that, although
I
admit
doubt
I
that.
don't
I
know
seriously
the,
doubt that. Emory
legal
IRB is in
structure.
trouble already. So I would seriously doubt. Anyway, I don't want to hijack this
Okay.
discussion.
Now, Jessica had her hand up, so I want to make sure. Go ahead.
I wonder what the possibility is for us to create a biobank here. And I don't mean just banking samples. I really mean, when I worked at the Duke Center for Human Genetics and Genomics, they had a biobank there where the samples would come in, they would process and isolate DNA from all of the samples, regardless of what kind of tissue. They would bank it, they would put it into a registry so you could understand how much was there. They would keep track of how much left, so we knew how much was left, right? I mean, this would be an incredible asset for us to have across grounds for people, especially people who don't know how to do this, right? And then maybe they would be limited in being able to do this kind of work because they don't know, right? So what are the opportunities for doing that?
Now, Jessica, how is that different from what Rutgers does for NIMH? I think
I don't think it's much different. The way I understand it is it's just that it's more accessible.
okay, because it would be here.
That's right.
Okay, and then
and we could take some of our samples and bank them there. Do you understand what I'm saying? But we could keep some here locally for people to work with.
Right.
The key is keeping track of how much is there and making sure you're giving the right amounts out. Does that make sense?
And then link, well, I guess, and something that's very different from what Rutgers does for us, or for anybody, is then being able to link it to this common data set of measures, phenotypic measures, biological characterizations that we're talking about, Micah, and that will help, kind of build something I think very impressive for center proposals and whatnot.
And then the last thing is, I'm sorry to interrupt, Kevin, when you do an epigenetics study or when you do a genomic study, you put that data there for people to use.
Right.
Do you see what I'm saying? So it's not just that we have the DNA, but somebody's already done a genome-wide SNP chip. That data needs to be there for everyone to use here locally.
Okay, and then that can be linked up, I think, in a meaningful way to a precision medicine effort, which of course is going to come after the neuroscience discussions, and they're inextricably intertwined. So one thing I was going to ask on a previous call, and then I didn't want to ask it in a sense because I was worried it would risk offending you, Jess, but it's like, I consider you a human geneticist. I mean, obviously you are, but then do we have, other than you, do we have, and I'm embarrassed if there's like 10 others and I don't know them, but do we have any other human geneticists?
Yeah, Steve Rich runs an entire center that is full of people who are human geneticists, yes.
But looking at neurogenetics, looking at things related to, so I'm thinking of people like Matt State or Dan Geschwind, are those hires that we're always thinking about hires. See, to me, you're capable of doing all of those things, but then there's the issue of like, how much do you want to be the one that everybody's
No, I'm fine. That's a good idea, Kevin. I don't have and it doesn't offend me. I'd love to have more colleagues to work with.
Okay. And then I think hiring at the level of an assistant professor coming out of either Matt or Dan's lab, would be fantastic. And then could be a multidisciplinary hire.
I think just to jump in on this, I think what seems to be coming up is the need for greater infrastructure around all of these areas, but also thinking about how to tie them together, because I think to rise to a level of preeminence, we need to have a system that breaks the silos so that people can seamlessly work together across these fields. And so having dealing with some of the barriers around, just the simple IT barriers and other health system, the academic side barriers is going to be important, but also thinking about how to allow a collaboration from the level of a biobank to educational interventions in the classroom, and how do we link the data that we're collecting on a biological sample to how kids are doing in their school setting would be something no other place is doing. So I really think that would help.
That's a really
And
good.
I love that. I love that. Thank you. I love that.
I know that several times Jadeep and others have mentioned identifiable targets and goals for our kind of sub-disciplines, and obviously being ready in 5 years. So we are an Autism Center of Excellence now, and we're going to focus on getting that network renewed. But we're kind of cheating because it's a network, so we're relying on some outside players to help us maintain that status. But having as a goal, 5 years from now, when the new version of the ACE is put out, that we're ready, that to be highly competitive. I think that's an obvious goal, and one that's probably very achievable if we have the right infrastructure in place and the right track record of co-publications and stuff like that. And John was here, and I hope we didn't scare him off by sounding like we weren't going to talk about anything other than human kind of models. But it seems to me that another area, like it's easy to seamlessly go between what Jess does and what Jamie does. Jamie's with us now, and what I do, and even imagine linking that to what the School of Education is particularly good at. But then we've got this incredible maternal immune infection, modeling and glial institute and inflammation experts. And that is such an emerging area in autism. To not have that integrated into our and they've been easy to collaborate with. Micah's funded, pilot funded some work there. The Brain Institute has, and delightful to work with. So maybe it's a problem. It's not a problem. It's just a matter of finding the right grant mechanism to go in together on. But like for instance, this most recent ACE Center RFA seemed to discourage. There was nothing in there that encouraged what I would call translational science, kind of going from animal models to humans and back again. So that disappointed me, but we've got to have that, as a field. And the same can be said of the epilepsy work that's being done in animal models. I think that's a unique strength of our autism world here at UVA is the ability to connect up with the epilepsy group. That's so world-class. So
I agree again. I think the most important thing we can do is work with the animal model people, but we have to identify exactly what we want to work on.
Yeah,
it's a lot, right? I mean, I've got variables in my lab, so I mean,
like I read his paper and I think I know what I'm talking about, and he's very polite, and he's kind of like, you're gonna have to be more specific about what you want to do, to really link it up.
So can we pull from strengths from your work, Kevin, that would allow us to find the right animal models, so that, I mean, is that a possibility?
Well, I mean, I think susceptibility, these sex differences and susceptibility to inflammation, and that and differences in epilepsy rates for girls and boys, that's a unifying theme. And I think that the emerging themes in the autism literature around inflammation and microbiome work, which is obviously another giant strength. I found Bill Petrie delightful to work with, super helpful, and Carrie Cowden, a new assistant professor there, is specifically interested in microbiome and early brain and cognitive development. So I think that angle, we leverage the network data on sex differences. And then like several of the people in STAR are experts on what I would say the non-biological aspects of sex differences. Like Rose, for example, has done great work on that. And so that could be a real strength to leverage.
So I think we need an infrastructure to pull these people together, right? So that we can feed forward and backwards, right? I don't think that's not the right way to say it, but how do we get all the people who could, create models for what you're interested in studying and then work together? Yeah.
Yeah, it's like we don't want to undo STAR, but we want to have STAR plus. It's sort of like
STAR 2.0.
STAR is perfect. And then now, and it's like a gym. And now can we get the animal modeling people together, both in the preeminence of the epilepsy program in animal and human work, and then John Lukens and others. And Craig, I'm sorry, you just wrote a note. You haven't had a chance to speak, so please speak.
Well, I just wanted to say I'm an MRI person from biomedical engineering, and just wanted to get a sense for what kind of imaging might be helpful for the human and the animal studies. Like, for instance, we could do fetal imaging and quantification of morphology in the brain.
In humans?
Yeah.
Oh,
and with automatic segmentation.
Okay. Well, you're going to get
fetal MRIs are now, fetal brain MRIs are done in pen and all routine.
You're going to get an email from me because I've been looking for a collaborator on this. So this is fantastic. I didn't know this was being done here. And
it's not being done here, but I'm part of a paper from Children's National.
Yep.
Yeah.
Oh, okay. Yep. I know that, that colleague. So that's, and then